hope everyone is doing great. In this video, I will be talking about how to pass your Nclex examination, and it also applies to the new changes that gonna be taking place for the Nclex examination. That's gonna be starting from next April. So it has everything you need to know to pass your Nclex. So basically, these are my notes that I use to pass my Nclex examination. So if you wanna get the full benefit out of it, please watch the whole video. And please, if you consider subscribing, I would appreciate that. It gives motivation for someone taking efforts to make the videos, so I do appreciate your help on this. So without wasting much time, let's jump right into it. Okay, so these are some of the topics I will be covering in this video. So like the fundamentals, Nclex, skill labs, pharma, all these topics I'm gonna be covering. And trust me, if you really do watch this video at least twice, I guarantee you're gonna pass your Nclex examination. So let's start with step by step. Okay, let's start with some of the test tips we can do before we can start doing the examination material. So we know the regular length of examination is 6 hours, right? So you have that 6 hours window to write your examination. And so how do we take breaks? I was a bit confused like when they told me about the breaks, and I was like, how does it work? So basically when you take your break, it does deduct from the 6 hours. Okay, so basically when they let you sit for your examination, so they tell you you can just raise your hand whenever you want to take the break. So what I did when I felt like I'm getting overwhelmed and nothing is going into my brain, I need a breathe. So what I did, I just raised my hand, they paused my test, and I just went out for like 5 minutes. I drank water, and then I just came back. So I took like 3 breaks, which were like every 1 hour. My exam ran till 3 hours. Okay, and I stopped at 79 questions. And the maximum amount of questions you will have in the examination is 145. It used to be 265. I didn't change that. Now it's 145 because of COVID. They don't want you to be sitting in that place for a long period of time. Okay, and they do verify your ID, so make sure you bring the photo ID with you. The best choice is passport or your driving license, because if you don't have your ID, they will turn you away. They will not let you sit in the examination. So every time you take your break, you need to bring your ID with you. Every time they'll do your full physical examination, want to make sure you're not cheating in the exam. So read the question and answer carefully. Of course, I'm not gonna lie, I did make a couple of mistakes, and then I realized, oh wait a minute, maybe I didn't read the question right. So make sure you want to read the question right all the time. Look for the keywords, that's another one. So basically, if the question have stuff like never, all, every, only, must, except, none, you have to look for it. That means it does talk about the answer, right? So what my personal opinion is, I always kind of delete or erase the answers that are wrong, and I just focus on the answers which could be right. So we all know, right, potentially there's only 2 answers which we always seem like they are right. So these are some of the test information I wanted to share with you. Another thing I want to mention is make sure you guys drink a lot of water, and you're well rested. I didn't sleep. I slept like for my, I would say, 3 and 4 hours for my examination, but you need to be well rested. Okay, so in this chart I want to show you, these are some of the styles. They will ask you questions like multiple choice, like SETA, like select all that apply. They will give you a question and you have to answer, select multiple answers, fill in blanks. They can give you multiple response where you have to choose more than 1 responses are quick, like are acceptable. Order response, figure, or hotspot. So basically what they did, I want to tell you, for the figure and hotspot, they show me a picture and they were like, where can we found this, where can we do this? For example, they can give you a picture, then can ask you where is apical pulse, where is brachial pulse, right? Or they can show you a picture, is like which position is best for for the thoracentesis. So they can give you questions like this. Okay, but mostly in the exam, the regular select one answer, multiple choice and pictures and figure and hotspot questions are very common. Okay, so let's talk about fundamentals now. So in the fundamentals, I have created another video. If you are interested, you can go watch that. That's very useful. But I'm just gonna cover some bases here. So if you know everything, but you don't know what other basic vital signs are, that's not good, right? So heart rate, we know what is the regular heart rate for the adult, 80 to 100, respiration 12 to 20, blood pressure, like 120 to 60 is the regular the basics we all need to know. Okay, so for serum electrolytes, guys, you need to know this. You need to memorize them like literally. Sodium is the big one, but you need to know all of these. They are very important. So, okay, I'm not gonna focus very much on them, but you can pause the screen and you can go over them. But you need to know all of them, whatever I mentioned. I couldn't memorize everything, but I did memorize these ones. Like these gonna be something I'm gonna be remembering throughout my life when they will do come to the examination. Okay. Okay, so in this part, acid-base balance again. So whatever I've created here, like these are the critical ones. Like whatever I have created the charts for, you need to remember this, like literally step by step. Okay, so pH, SCO3, PaCO2 for the acid-base balance. We need to know what is normal, what is abnormal. This is very important. So you guys need to remember this. Okay, so out of this, pH is very important, but everything else is important as well. Okay. Guys, when I was preparing for my Nclex examination, I was keep on getting the questions in the practice test, like for the different glucose finding, and I was like, what's going on? I was not able to understand them. So I have created this a little chart so to help me remember, because I'm pretty sure all you know is the regular glucose is 70 to 101, 170 to 110, right? But there's like so many other glucose levels that we need to remember, and trust me, Nclex will try to trick you on these. So you need to know these values. Basically they look the same, but there is a difference for the timing, right? There's a different for that what you call the fasting, the baseline fasting, 30-minute fasting, 60-minute fasting. If you know these, trust me, you're gonna have easy time passing your Nclex examination. So please remember them. So what I've tried to create for you is already less, so don't skip anything out of it and you will get benefit of it. Okay, in the beginning in the nursing school, all I knew like about the digoxin and the therapeutic level. I know this was a critical medication, but for the other drugs, like some of the drug I have mentioned the names here, you need to know the therapeutic drug level of them. Okay, like Taninol is, I'm pretty sure none of you knew about the therapeutic level, but these kind of question does come to the examination. They might give you a scenario where this, where like ABC patient is taking, Taninol, and they suddenly became very drowsy and they have medication side effects, and so what their the medication level is at, like 15, 18, is it therapeutic or is it like within normal range? So these medications you do really need to know everything about it. Okay, like acetaminophen, very important. Digoxin, like if you can't remember anything, remember at least lithium. Lithium is very lethal drug. Magnesium, that one we give to the pregnant ladies, very important. Phenobarbital for seizures. Phenytoin sodium is another very important one. And actually all these are very important, so please memorize them. And if you notice, all these values are like starting from 10, 20, 15, so you can just kind of try to memorize that, make a mnemonic out of it, and they're gonna help you. What I'm trying to show you is what is important for you. Okay, so please try to remember these, and that's they're gonna give you the benefit. And you know what, if you see the success in your examination, please don't forget to share that. Okay, I know you're gonna pass this examination with this. Guys, maternity for the Nclex examination is another vast topic. I'm planning to create another video that's gonna help you on this, but these are some of the things I wanted you to remember. What should be the normal fetal heart rate, right? 120 to 160. More than 160 is very that means mother has fever, mother is sick. So right, we just kind of monitor that. Less than 120 is danger. That means baby is not doing great, right? So we need to kind of monitor the baby more frequently. The fetal monitoring needs to be very important. So one thing in the maternity, remember the lion approach, very important. LION. So lion approach is whenever we see something wrong with the mother or the baby, we use the lion approach. L means lay them on their side, I means IV, O means oxygen, and N means notify the doctor at the last. Okay, we never notify the doctor in the beginning. So lion approach is your friend for the Nclex examination. Okay, so we need to know what is the variability is, what is the normal amniotic fluid, 500 to 1200. If it's more than 1200, we call it polyhydramnions, right? So we need to remember that. And contraction, how should the contraction be? Between 2 to 5 minutes, right? More than 90 is what? It's called uterine tetany. That means the uterus is like super contracting and there could be a serious consequences. We never want to see the contraction lasting more than 90 minutes. Remember, the term is called uterine tetany at that time. Apgar score, very important. We check the Apgar score at 1 and 5 minutes. We all know that, right? We never want to see the score of 0. It should always be between 4 and 7. Okay. And Apgar score tell us about the baby, right? Their appearance, their pulses, their grimace, their activity, their reflexes. That means the baby will survive in the outer life. That's what we want to know when we do Apgar score. Okay. And let's talk about umbilical cord. So umbilical cord should have 2 arteries and 1 vein, right? If you see anything wrong in that, you need to let the doctor right away. In Canada or in Western countries, usually they will have a pediatrician who will be present for the baby when the mother give birth. So basically they will see those kind of complications right away. Okay guys, let's talk about rule of 9. So in the rule of 9, we all know, that there's a human being, right? We divide their skin in their body into the compartments. Okay, so we call them total body surface area. Okay, this one. So head and neck. So head and neck is 9%. Upper limb, like right, these ones are 9% front, 9% back, so 18% on each side. Okay. So trunk is 36%, like this part. Legs is 36%, so like 18%. 9 front, 9 back, 18. 9 front, 9 back, 18. And genital is 1%. So there's another picture for the baby. Okay, so it'll help you understand what rule of 9 is. Okay, so it's basically the same with a little bit of moderations. Here there's a little chart for you to understand. Okay, so if it's less than 1 year, like how do we calculate that? 1 year, 5 year, 10 year, 15 year. So that's how we calculate the rule of 9. Very important. It might come to your examination. So this is something you need to know. If you don't have your basic clears, it's gonna give you a hard time understanding everything. So in this video, I try to create it in a way that it helps you understand the basic and advanced at the same time. Okay, so that's what it is. And remember the rule of 9. Let's talk about some of the skills now. So for the skill part, what procedure you need to know for Nclex, right? We're not gonna read the whole fundamental of nursing, but there are some topics you need to know that might appear in the Nclex examination. So those topics I will be sharing with you today. So blood transfusion, that's something you need to know with your eyes closed in your sleep. You need to be able to answer those questions, okay? I've created another fundamental of nursing video that talks about blood products, when to infuse them and everything. So please consider watching that. You need to know what is thoracentesis. Let me go back to blood transfusion. You need to know what are the complications, what are the transfusion reaction for the first 15 minutes, okay? So that's something you should know. And who can administer the blood? It needs to be RN for the Nclex examination, okay? So let's talk about thoracentesis. In the thoracentesis, actually you need to know how to perform that, what should be the position. So positioning is, Nclex loves to talk about the position of the clients when doing certain procedures. Okay, IV site complication you guys need to know, and what to do when you discover a IV site complication. Are you gonna let your doctor know, or what you're gonna be doing? So basically you're first gonna be assessing, and then you're gonna be letting your doctor know. PPE, how to put it on and how to put it off, that is something you need to know, very very important. But I'm gonna talk about PPE in the further slides. Isolation precaution, what to wear when we enter into the client who have respiratory issues when they are on isolation. So very important, you guys need to know. So I've created another slide, so I'm going to be talking about that. Okay, so guys, if you think I'm speaking a bit fast, you can always pause the video and you can just kind of, go over the stuff that I'm talking about, because I'm trying not to waste time here. I'm just kind of jumping, um, so that I'm not wasting your time. So basically, if you have any question, you can always pause the video and watch it. Okay, so infection disease, so these are my notes that I've created with a lot of hard work. So if you can see, I'm just gonna try my best to read it for you. So for the contact precaution, so contact means when we cannot touch anyone, right? I'm just gonna try to make it understand for you in a labor. Who is on contact precaution, right? The Nclex will ask you a question and you're like, I'm not sure. So I'm gonna tell you who. Person who has herpes, who has MRSA, who has cholera, shingle, rotavirus, RSV, respiratory syncytial virus. Okay, so these will be the people who will be on contact precaution. There's like tons, but these are the ones you need to know for the NCLEX examination. Okay, so what we're gonna be doing for them, so we're gonna be putting them to a private room. They need to put their gloves, gowns, and wash their hands, and they're gonna use the disposable supplies for food, for everything. Okay, disposable is the key word here. And let's talk about droplet. Okay, so in the droplet, what you need to know is, they need to be, if they have viruses, all kind of viruses, all influenzas like Tdap, pertussis, mumps, they need to be on droplet precautions, and they need to have private rooms, gloves, hand washing, and patient wear gloves whenever, patient wear mask whenever the person goes out. Very 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 important. Okay, so if they wear mask when they go out is droplet, and if they use disposable, they are contact. Okay, some of the tips I wanted to give you on which resources you need for the U World. I finished U World from one question to the end. I did like I would say more than 2,000 questions, like rationals, everything in too much detail. I did write those, the notes I prepared for you. So U World is like best. I didn't find any good resource than that. Make sure you, if you're comfortable with that, you can use that. There's Archer and other reviewers. I've created actually another video talking about that. If you're interested, you can watch that. So Mark K videos, my friend told me about Mark K, Mark Clymer. So they told me the videos are great, you should watch that for NCLEX examination. So I did go over his videos, and trust me, he does talk about facts. It was great. You can find those videos on the YouTube, so they are the best resource for you. So if you want to utilize that, I would say go ahead and do that. Hello friends, in this video I'm going to be talking about some common diets that we need to know for the NCLEX examination. So for the NCLEX examination, we need to know what is the diet for the acute renal disease. There are tons of disease, right? But these are the ones we really need to be knowing the diet for. So for acute renal disease, what should be the restriction? No protein, protein restricted, high calorie, fluid control, sodium potassium control, right? For example, for burns, high protein, high calories, because we want the burns to heal faster. Cancer, high calorie, high protein, again, protein helps with recovery. Celiac disease, no bro, no bro, I cannot eat celiac containing food, no gluten for me. So bro means barley, rye, oat, wheat, cirrhosis, normal protein, not extra, not less. COPD, soft, high calorie, low carbs, high fat, small frequent feeding. The reason behind it is with the COPD, they get their oxygen, carbon dioxide supply is getting consumed. So we don't want to overtire them. So that's why we give them small frequent diet. So these are the most important diet for the Nclex examination. So I'm not gonna go over them each of them, but make sure to pause your screen and remember this to pass your Nclex examination. So guys, another important topic here is positioning client. Nclex loves about it, like loves to talk about questions which are related to positioning. So again, I'm not going to be talking about every single condition here, but you need to know the positioning of these diagnoses that are mentioned here, because these are the critical ones. Like example is asthma, you need to know which position the patient need to be laying, right? Ischemic stroke, cardiac catheterization, again the one which are highlighted in blue is like most critical ones, so you need to know. Again, you can just pause your screen and go through them, and I'm gonna jump to the next video. But remember, it's critical. If you don't know this, you're gonna have hard time in your examination. Guys, when I was doing my Nclex examination, I was like, how I'm going to remember, how in the world I'm going to remember every single sign and symptom, because there was like every disease had like 15 sign and symptom. So what I did, I created a little like notes like this, like handouts for myself. So common sign and symptoms, I should know what is the common sign and symptom for TB, like low grade fever, pneumonia, rust colored sputum, right? Asthma, wheezing on expiration. So this is something I have created. So that's gonna help you pass your examination. Please remember this. These are not like tons, but these are critical ones, right? And did you know that you get Koplik spots with measles? So these are the things you need to know, right? These three, the one I've highlighted in black, emphysema, Kowalski, pernicious anemia, are the most important ones, guys. They look, I'm pretty sure you might have not heard about Kowalski, but Kowalski is one of the topic that Nclex favorite, so remember that part, okay? So systemic lupus erythematosus, very important. So again, I'm not gonna be wasting too much time for you guys here, but if you wanna, memorize them, you can watch the video. So I have two slides that talks about the common sign and symptoms, okay? These are some other sign and symptoms you guys should know. Again, these are only two slides. I'm pretty sure for the examination that's already very hard, you can at least remember what is important. So you should focus on these symptoms. Again, the one which are highlighted for like in blue color are the most important ones. If you cannot remember everything, just try to remember at least these. But no one will explain it in a way I did. Like tetany, what is tetany? Remember I told you, if the contractions lasting more than 90 minutes seconds is tetany. So what happens in that? What are the symptoms, right? So these are the most important ones you should know. Cushing syndrome, moon phase, that's something we know, right? So it took me a lot of time to remember that. If they can help you, I would be very happy. So the next one, the topic that I'm going to be discussing now is the most neglected topic by the students for the Nclex examination. So type of fluids. Trust me, this is the most important one. This is one of the fundamental Nclex put their emphasis on. So you need to know what are the type of fluids. There's hypertonic, there's isotonic, there's hypotonic, right? So these are the very important ones, and you need to know what comes into the hypertonic. So what I did, I just created a little bit of information. So first of all, what are hypertonic? So what is the meaning? So concentration of solute is higher than the concentration of solutes in the cells. Okay, so basically example is D25, D50. For why do we use them? For hyponatremia. So if you get a question which talk about hypovolemia, hyponatremia, the answer is hypertonic fluids. Next, talk about isotonic. So isotonic used to expand the fluid volume when someone is has what you call when someone has wounds, when someone has a volume deficit, when someone has burns. So that's the first line treatment. It expands the volume, it adds fluid into your body. So basically D5W, 0.9% normal saline, RL3, they are very, very important. Hypotonic fluids, they are 0.5, 45% NaCl. So they are very, very important. They increase the concentration and they replenish the fluid in the cell. So you should never be giving it to someone who has burns because it will cause the cell swelling. Okay, remember that. Okay, so the critical information you need to know for the restraint is if you see a question for the restraint, what we want to be knowing, we want to be using the restraint as a last resort. When nothing else is available, only then you can use the restraint. You always need doctor's order. A nurse cannot, a RN cannot administer the restraint if she feels like it. Okay, and you need to decide about the restraint as a group. Okay, it's not that you think it's appropriate, the doctor think is appropriate, you can implement it. No, that's not true. So you should be doing it together. Okay, as a team. Even the healthcare aid, everything needs to be involved, all the team, and then they decide what is good. Okay, whenever the patient is on restraint, we want to be checking them every 30 to 60 minutes so that we could make sure they are okay. We need to release them from the restraint at least every 2 to 3 hours, and we need to discontinue them as soon as possible so that we could make sure the patient is okay. Okay, so restraint is something nobody want to use it these days, and Nclex doesn't want to see that you like to use the restraints. Okay. Okay, so let's talk about pediatrics now. In pediatrics, the most important thing is milestones. You will have scenarios like you have a patient, you have a baby who came to the hospital, what kind of play they will have, what kind of milestones they will have. Out of these milestones, the one I've created are the most important. Of course, you cannot remember everything, so I've created these notes that are important. But out of these, 6 to 7 months is the key, very important, because for the baby, the most important things are happening at these months, right? So they can wave bye bye. They can start sitting with support. They have their head control. They can hold their head straight. They can pass things from one hand to another. So very, very, very important. So all these others you can review. I'm not gonna be wasting much time for you on it, but you can pause the screen and you can just kind of go through it. So that's what it is. Okay. Okay, let's talk about head circumferences for the baby. When they're born, what should be their normal head circumference? 12.5 to 14.5 inch or 32 to 37 centimeters. What do we need to report? I think no one ever thought about it. Nclex want to know about it, right? So report less than 12.5 inch or more than 14.5 inch. So that means something is wrong with the baby. Something is not right. Or less than 32 centimeters or more than 37 centimeters, we need to report it to the doctor. We need to know what are the vitals which are normal for the newborn. Respirations, right? Heart rate, blood pressure, heights, what we need to know what is normal. So again, anything less than the normal range, we need to report it to the doctor right away. What are the vitals for infant? So infant is what age? It's starting from 1 month to 1 year, right? So these should be the normal vital signs for the infant. So we need to know the basic before we jump into the actual in-depth stuff. So when a newborn is born, what are the few things we need to keep in our minds? Okay, so what should be the normal glucose for them? When they need to pee and void, so void or pass stool within 24 hours. When they don't pass urine within 24 hours, maybe there's something wrong with the opening, something with the bladder, right? We need to figure that out. We need to notify that. If they don't pass stool, maybe they have condition that means the intestines are not working properly. Okay, so newborn care, what do we do immediately when the baby comes out? So we suction their mouth or we suction their nose. We suction their nose first, we suction their mouth second, we maintain their regulate their temperature, we put them in incubator or in a heater, or we heater. Now you don't put them on heater but in a heated environment. They usually in Western countries they have like heated blankets they use for newborns these days. they need to take their vitamin K injection within 6 hours because their the clotting factors are not fully mature yet, and so that's why we give them vitamin K, that the K injection that helps them for the next 6 months before they get their own immunity. Okay, a CAR score, that's the another thing. Remember we talked about it, and we do it at 1 and 5 minutes, and it helps the baby, it helps us to understand about the baby, how the baby is reacting to the outer life. Okay, so let's talk about psychiatric nursing. So whenever we are answering any question regarding psychiatry, remember the Maslow's hierarchy of need. We always want to take care of their physical need, then their safety, then their love and belongingness, that is psychological need, then self-esteem, and at the end self-actualization. We never want to make false promises to them. We never want to accept gifts from them. No personal relationship, only professional. No false advice. For example, they ask you for a depression pill. They ask us like why it's not working. You never lie to them. You just you give them real information. You tell them it takes time. You tell them what is the real stuff. Okay. And if they talk about hallucinations, I'm hearing voices, I'm seeing people, you're gonna tell them you are not gonna play the same game, right? You're gonna tell them I cannot see anything. They might be true to you, but I'm sorry, I don't see anything. That something will help you recover them faster. So these were some of the tips I wanted to give you about psychiatry. Let's jump to the next slides. Another most important thing you need to know about psychiatry nursing is difference between delirium and dementia. So delirium is something, so when you are, when you have neuro problem, when you have acute onset, they are fluctuating, the duration could be hours to week, they are reversible, they get better. So basically what happens, what who get delirium, basically there's a patient who is hospitalized, and they hospitalize for a long period of time. That's when they start getting these neurocognitive symptoms like confusion, restlessness, like temporary mental symptoms, right? They usually get resolved when the condition gets better. But with dementia, they are more permanent. They just only get worse. So you need to know what is the difference between delirium and dementia. I try to explain that in this slide here. So if you want to learn more about it, you can pause the screen and you can compare it. Okay. But one thing I want to tell you about these two, delirium is reversible, like those mental health symptoms will get better when you are treated, when you go home. But dementia is a irreversible condition. Once you get the mental health symptom, they never get better. So basically, if you see a client who is hospitalized, who is getting symptoms like mental confusion, restless, and all those things, that means he's in delirium. Okay, you need to notify the doctor, but usually they get better. But so you can watch this slide for this. Guys, another most important topic I'm gonna be talking about here is the abnormal personalities. You need to know at least 3 of these personalities, which are very important for the Nclex examination. So what is antisocial personality? You need to know. So basically in the Nclex examination, you will have a scenario where they talk about, this person is this, they are irresponsible, they're manipulative, what kind of personality they are. So you can select between antisocial, borderline, narcissistic. Okay, so the antisocial personalities are, they violate the right of others, like usually they don't care about others, they are not responsible, they're manipulative, like they use other for their own personal gains. Okay, so that's what is antisocial personality. Borderline personality, what is it? So that means they have unstable relationship, right? They're not good spending their personal life, they're restless, they have chronic feeling of being empty, they don't feel good, they don't feel enough. So that's borderline. Narcissistic is like negative personality, right? So basically they have grandiose, means they think they are superior, they think they are the prime minister of the country, they need excessive amount of admiration, you need to be like praising them constantly, they are very arrogant, like they don't know how to talk to people. So the treatment for all these personalities are use what we're gonna use. We're gonna be acknowledging their feeling, we're gonna show them the real picture, we're gonna set limits, we're gonna enforce those limits, and we're gonna tell them what is acceptable. We're not gonna buy the personality they are using. So that's what we're gonna be using. Very, very important. Okay. Okay guys, so let's jump into the pharmacology part. Pharma is very important. What I personally did, I created my notes and I did watch the simple nursing videos. They are great for pharma. If you can get some benefit out of it, I would be very happy for you guys. So medication, these are some of the medication you need to know and what are the side effects. So out of these, the one I highlighted in green is very, very, very important, like digoxin, aluminium, midazolam. What happens, sometimes we even go through 3000 questions, but we don't put focus on these ones, and then it doesn't help us succeed. So that's why I on purpose try to create it so that you can get the full benefit out of it. Okay, so you need to know some of the medication, like I said. Okay, amiodarone, you need to know the side effects of this. Warfarin, very, very important. Dopamine, very important. Rifampicin, ethambutol, remember the side effect, guys. I did talk about crutch walking on my other videos, but you need to know what you need to know with the crutches, canes, walkers. Whenever you're going up, you go up with a strong leg. Whenever you're going down, you come down with a bad. So I have discussed that in my other videos, so make sure to check that one out. So this is something you should be knowing about the crutch walking. So guys, this video talk about STD, sexually transmitted infection. Out of this, herpes is the most important one. Make sure you know if the patient has painful vesicles, not painless, but painful vesicles, that means they have herpes simplex. So these are some of the other sexually transmitted infection. You guys need to know what are the sign and symptoms, like genital, you get warts 1 to 2 millimeters, and gonorrhea, green creamy discharge. Basically you need to know the amount, the type, the color of the discharge, and you need to know as RN what are those discharge. If it's a milky discharge, I know it's chlamydia. If it's a white cheese color discharge, I know it's candidiasis, which is a fungal infection. Okay, and we treat it with nystatin. So you need to know your facts. Okay, trichomoniasis, yellow itchy frothy foul smelling discharge, very important. You need to know this for your Nclex examination, guys. I hope this video was helpful for you guys. Again, if you like my video, please consider subscribing. If any one of you pass the Nclex examination, watching my videos, at least share so that it encourages me and other students to make more videos for me and help other students to pass examination and spread this video. But again, like, you must have seen so many reviewers, but you would have not seen this to the point and more good information reviewers. So please consider subscribing and keep on watching my videos, guys. And good luck with your Nclex journey, and remember, you're not alone.